All right. It's 8:30 and we've got a pretty good grip on this morning, so we're going to go ahead and get started. This is Meredith. Thank you all for joining this morning for our sharing call on the next in our series talking about the provider satisfaction survey. We have Inka back with us this month, which I'm so excited about. She has just an extremely handsome new little boy, so she's been out for the last 3 months and is back to work. So again, this is Meredith. I am a senior quality improvement facilitator with Telegen here in Colorado, and we're tasked with helping bring diabetes self-management education and increase access to underserved populations in Colorado under contract with the Centers for Medicare and Medicaid Services. Inka?
Good morning, everyone. I hope you all had a great summer. I sure did, but I'm glad to be back. So my name is Inka Baku, and I work at the Colorado Department of Public Health and Environment in the Diabetes and Cardiovascular Unit, and we have a CDC grant to promote and increase participation in the diabetes self-management education and support programs in Colorado. And so that's what brings me here to the calls and work with Telegen and Meredith to provide technical assistance, guidance, opportunities like these monthly sharing calls to you all to support your programs in Colorado.
Thank you, Inka. So really the purpose of these calls, due to the low prevalence of diabetes education amongst Coloradans affected by diabetes, our primary intended audience is for ADA and AADE program staff or those that are intending to start a program. Others are certainly welcome to listen in and join, but that will be the primary focus of our discussion.
So just a couple of housekeeping reminders. Please use *6 to mute and unmute yourself. Don't place your line on hold, so if you do need to hop off the call, just hang up and call back. When speaking, please state your name. We really encourage in-depth sharing, so step up and step back when you feel it's appropriate. If chat is an easier way for you to communicate, there is a chat box on the right-hand side of the screen, so you can chat your questions throughout the call. And then we also record this call, and so I will send those links out with the call notes a few weeks after the call.
On this slide, we just have a visual of where we've been since we started with these calls. Really in the beginning, just really hearing from all of you on what your biggest challenges were within your programs and developing agendas according to that. We did a few survey monkeys. We started the sharing call series and did some inquiry that way. We also had the April DSMES Sustainability Conference last year, which Inka just did an amazing job of putting together and got a lot of feedback from those of you that attended that by way of evaluation as far as letting us know what would be helpful to continue discussing and bringing out to you. So really the ultimate goal at the top of this slide in yellow, you'll see again, is to help increase the utilization of DSMES services in Colorado, especially billable and allowable services, because we want you all to be getting reimbursement for the wonderful services that you provide throughout the state. So here is where we like to see who we have on the call with us. The look and feel of WebEx is a little bit different. So if you can left click on the little squiggle mark, which is in the left-hand side of your screen, that will open up the option for you to left click on an arrow. Once you click on that, drag it over to the map, left click again, and drop your name for where you're attending. Good morning, Sam.
Good morning.
For those of you that are not on WebEx, would you mind announcing yourself?
This is Kim Ayers.
Oh, sorry.
Kim Ayers.
I heard Kim.
Yeah, in Durango.
Good morning, Kim.
Good morning. And this is Roseanne, and I just can't get my squiggly thing to work.
Good morning, Roseanne.
This is Yvonne Romero. I can't get my squiggly thing to work either.
So you see the squiggly line, you just can't left click on it, is that right?
I left clicked on it and it brought up an arrow and a TR and like a square and stuff, but when I click on the arrow, it doesn't drag.
Did you right click on the arrow?
Yes. And it brings up arrow pointer. And so then I click on, oh there, wait, maybe I got it now. I got it. So it brings up another menu that says arrow pointer. So then from that menu you pick arrow pointer and pull it down. Okay.
There we go. All right, we see you all now. So just kind of a fun way to visually see where everyone is calling in from. We've got some good representation from across the state this morning, so good to have you all on the call. Is there anyone else on the line that hasn't yet announced themselves? All right. Go ahead, Inka.
Oh, I was on mute. Sorry, I was on mute. Talking away. So we always like to guide our calls with some learning objectives. So we have been covering Standard 10 all summer, which is the Continuous Quality Improvement Standard for the 2017 DSMES National Standards. Meredith has been going over a plan, do, study, act process, so we'll just have a slide to again regroup and think about how we use that for our quality improvement. This is just one example of many types of quality improvement theories, and then just continue to talk about the provider satisfaction survey that you all developed this summer, and how that is an example of a provider outcome quality measure. So just again, here's that standard again, that with accredited and recognized programs, that you have to have a quality coordinator that will measure the impact and effectiveness of the DSMES services and identify areas for improvement by conducting a systematic evaluation of a process and providing outcome data. And so what we've learned from Marianne Bogowitz is that a lot of programs just really have a hard time with this standard. And so before the summer, Meredith and I came up with the idea to do that 3-month series to develop a provider satisfaction survey. And that can be used to meet your standard 10 if you choose to use that. But there's so many things that you can with that facilitated conversation, you can come up with several other projects from the results of your provider satisfaction survey, and so that's what we're going to cover today. So the next slide. So again, this is just a quick overview. Some of us may be super familiar with this process, some of us may not, but essentially what it is, it's a straightforward, iterative approach to quality improvement in your practice. So has 4 steps. And the first step is plan, so you're developing your initiative of what it is that you want to improve. And then there's the do part where you implement your plan. And then once you implement your plan, you continuously collect results and check the results, and then based on that, you act and you can make further improvements to your program, process, whatever it is that you're looking at.
So if we think about what we've covered in June, July, and August, where we really drafted the provider satisfaction survey, and then in August talked about ideas for disseminating and getting good results from distributing that survey, that really fits within the plan due portion of that PDSA cycle that Inka just spoke about. So then this month, the way that we've designed the call is to tailor the conversation around how basically reviewing your results once they come in is the study portion of that, and then using those results to then inform an improvement plan.
This is Roseanne. Can I ask a question?
Sure.
It seems like maybe I missed it, but that you were going to send us out a copy that we could edit of the provider satisfaction survey, and then there was some discussion about maybe developing a survey monkey. I wondered where we were with that.
Yep, good question, Roseanne. We were going to talk about that a little bit at the end of the call. So basically, we're working on getting authorship information on there, and then also CDPHE is reviewing the format just to make sure that it's in a compliant format. And once that's finalized, we will get that distributed out to all of you.
Okay, thank you.
Yep.
So we always like to poll the group, the audience, to kind of gauge where people are at in the topic for the call. And so today's question is, what part of the CQI process is the most challenging for your DSMS program? Identifying an area for improvement, determining timelines and important milestones, collecting, analyzing, and presenting the results, getting support and buy-in from staff, understanding the difference between outcome and process measures. Not applicable if we don't have a DSMS program yet. And so the poll is going to open up on the right-hand side. You have 30 seconds. Select one answer and be sure to click submit. So the time is up. So it'll just be a few seconds for the results to populate. Okay, so let's see what people said. One person said identifying an area for improvement. So hopefully you'll get some ideas after this call. Determining timelines and milestones. Hopefully we can understand a little bit more about all the different terminology. I think that's kind of I learned as I was preparing for this call is kind of tying it back to your outcome and process measures, collecting, analyzing, and presenting the results. So there's two of you for that one. And then getting support and buy-in, that's a big one. So we can provide some suggestions and ways to get everyone involved in a QI process, and then understanding the difference between outcome and process measures. So yeah, everyone, it was kind of across the board. So great. We'll definitely cover this as much as we can today, and then we'll continue to think about as we move through other calls of how we can support you in the QI process.
So for those of you that have been on the series call with this provider satisfaction survey, this slide looks familiar. So basically, the provider satisfaction survey is an example of an outcome quality measure. So provider satisfaction results can help you identify the areas of improvement to increase referrals to your program, and also identify the best way to communicate back to the provider on patient outcomes because of the education received by your program. So for the facilitated portion of the call, we're going to review the final satisfaction survey and just hypothesize some potential responses from providers. And assuming that the quality improvement goal then would, excuse me, the goal would be to obtain strongly agree responses from the providers that are completing the satisfaction survey in all three of those sections, which then would indicate that there's a realization of both provider outcomes and program outcomes. So again, anything other than those positive responses might indicate an area for looking at improvement.
I'm on mute again, and I'm just talking away. I need to get back to the swing of things. So for the next 10 minutes or so, we're just going to go through the provider satisfaction survey again. But more, I want everyone just to kind of think about the study act part of the PDSA. And so I know that we don't have actual responses, but just kind of hypothesize. And a lot of our thinking is going to be more to the neutral and below. So neutral, disagreeing, strongly disagreeing, because you may get some responses like that. We hope you don't. But that means that then we can definitely come up with potential projects to improve provider satisfaction. And so the survey was divided up into 3 sections. And so the first one was the effect of DSMS on the overall quality of care I give to my patients. So trying to get feedback from providers that if they refer their patients to your program, that it should improve clinical quality outcomes, improve behavior change outcomes, reduce inpatient stays, urgent care, walk-in clinic visits, and ED utilization, and improve overall ability to manage their diabetes. So thinking through the difference between a process measure and an outcome measure, a process measure would improve, for example, the clinical quality outcome. So that the outcome measure is the result. So the education that you provide is the process measure, but the outcome measure is a lower A1C, for example. So I just want to kind of present, it helped me kind of, when I put it in that terminology, it helped me understand the difference between a process measure and an outcome measure. So looking at this slide, what would you do if you got some responses that were neutral or below in one of these areas?
This is Roseanne. I would want to dive deeper if possible and see if we could figure out what it was that caused them to answer the way that they did.
This is Sam, and I would agree with that. I think, maybe making sure that we as a program are communicating what we are seeing. Are we making sure that we are communicating the changes in behavior or ability to self-manage their diabetes, like what we are seeing? Are we communicating that back appropriately with the PCP?
So thinking a little bit deeper, in your experience, if you got a response that they disagreed with the clinical quality outcomes, what is that connected to in terms of your education?
This is Carla. And I was thinking in the context of that the hemoglobin A1C, for example, would be like a clinical piece that can be evaluated, you know, every 3 months if need be. And I don't know, to me, follow-up with patients can sometimes be really elusive. And so, you know, if that, you know, if we're having difficulty finding comparison data, you know, from at the beginning of coming into the program till in the middle of it to the end, you know, what are we doing as far as follow-up goes, and assisting the physicians in, you know, staying in touch with the patients to make sure that they do get in for those lab checks and things like that. Does that make sense?
Yep. Yeah, so it's, again, a lot of the stuff is kind of going back to a process. And so what process could you create in your program to collect those A1Cs? And so an example would be percent of patients with diabetes who have a current A1C documented. And then trying to find a process that gets that every 3 months that they get an updated A1C to reflect, and hopefully it lowers, and then sending that information back to the provider.
Yeah, this is Yvonne. In the past, we have looked at those quality measures and have tried to figure out what we could do to help. We did do a PDSA, and with foot exams, we were really low, so we did 2 foot exam clinics where we just scheduled a lot of those people that didn't have them, and got them in there and got their foot exams done. But yeah, it is diving a lot deeper and seeing exactly what you can do to bring up those quality measures to assist them.
And this is Carla, and just to kind of add on to that comment, with regards to the A1C, we started sending out letters monthly that we were able to generate through our EHR, and notify people of it was several different prevention type things in addition to A1C, but that was included. And if a person was due, that letter would go out to them, and it did spark some response, so it helped definitely in adding that to our follow-up process.
And documenting that and then evaluating it, and so putting some sort of tracking on that process to see if it really is effective. So you could send out letters, but is it making a difference in A1C? And so that's what the whole quality improvement lens is to really hone in on a specific area, and it's forcing you to move through this process to plan, do the project, how to collect the information, and then what do you do with that information?
Right.
This is Jenny, and we kind of had something sort of similar in that we had some patients who hadn't come in for an A1C similar, and in the past year who had kind of fallen off, and we contacted the patients via phone and invited them to a group visit. So that's kind of how we're at this time, reaching out to some of those patients that were kind of disengaged.
So you utilize the group visit specifically for an A1C recheck?
Yes.
Oh, that's a good idea.
We're really excited to see, we actually have the group visit today, so we're excited to see how this works for the patient.
What kind of RSVP did you get? Or is that to be determined?
I'm kind of surprised because some of the patients needed a financial screen appointment, and maybe had a hard time getting in for the financial screen. We were surprised. We actually had a pretty good response rate. We were not expecting, to be able to reach a lot of the patients, but quite a few patients said, yes, I've been wanting to come in. I just haven't gotten into a financial stream yet.
Okay.
Thanks for sharing that information. So I'm looking at the time right now. We have 5 minutes. I always love it when we get a conversation going, and with our 30-minute time limit, we want to be mindful of everyone's time. So moving to the next 2 slides, it's the same process, and so maybe on your own time, and we can maybe regroup on this conversation in a few months, maybe when you actually have results. But again, not to assume that you're going to get strongly agree responses. We hope you do, absolutely. That's amazing. But this is the intent of sending out a provider satisfaction survey, is that if you do get responses that are neutral and below, then you can really hone in on that question and develop another Plan, Do, Study, Act process with that. And so to see if it changes, if it's effective, and if it changes results. So this one is the effect of DSNES on my relationship with my patients. And so these are really examples of operational processes for the provider, that if they can spend less time on the diabetes education part and focus on other areas of care, that is of value to that provider, and so that's an operational outcome. And so again, the next slide is wrapping up the whole survey, and it's that feedback loop back to the provider, that they're satisfied with the documentation and communication forwarded from the diabetes educator. It'll be exciting to see what kind of results you get, and then we can regroup in a few months, or we can decide that later if we want to have actual results, and you can all provide information from what you gathered. Anything else anyone wants to add? Any clarification? I wanted to actually chat a helpful resource that I use to help facilitate this call, and I will put that in the chat, and also put it in the notes when I send out the notes. But let me find the chat. But this is a really great resource that was provided. It's a new screen for me. So this is a great toolkit that I used, which explained the whole PDSA process for me.
Thank you, Inka. And I'm curious, before we close out, in regards to thinking about the polling question and the area that talks about measuring and then sharing the results back with providers or back with, say, an advisory group, do any of you want to share quickly about how that's looked for you? I know some of you have mentioned that you've done surveys in the past. So if you've been through that process and feel it went well, is that something that you would be willing to share real quick?
One question, this is not completely related to your ask, but I was just wondering, I was just thinking about, some of the questions within the survey. Do you think it would be helpful if each question had the option for comments, just in case the provider had comments about, whichever measure they're looking at?
Yeah, so what you can't see on the screens that we have today, Jenny, as we worked through drafting that satisfaction survey, there was a really strong desire to keep it very short. Because people from past experience said that they will have a higher chance of getting responses. So at the bottom of the survey, there's a statement that says if you have any additional comments, questions, please use the backside of this survey to share your thoughts or something around that, just to cue them into, yeah, I might I might have something else that's really important to me, but there's not really a way to state it through these questions. So that's how we address that. Does that seem like it'll work for you?
Yeah, I was just curious about that. I was just thinking as we were tearing down, so thank you.
Yeah.
Meredith, this is Carla. Real quick, I don't think I was able to participate in the calls in July and August, so I wasn't aware. Is there any way I could get this survey? Because if you sent it to me, I'm sorry, I don't know where it is.
So, yeah, and actually what we're going to do, so here, let's move on through the next slides and we'll talk a little bit about that and what actually obtaining the survey looks like.
Okay.
So our next calls will be in October, again, 8:30 or noon. For our October calls, just like Inca put together the April conference this year, they are planning a conference again in spring of 2019. So we're going to use the October call to solicit ideas from you on what you'd really want that conference to include. So we're excited about that. And then, Inca, do you want to talk about where CDPAC is with the survey?
Yes. So we got the green light. They reviewed the survey, and it's good to go. So between Meredith and I will send out a communication via the MailChimp. That's how I communicate with all of you for these calls and the call notes, and provide the link. And so it will be a Word document because you'll need to modify. So I'll provide instructions on what you can modify and what you can't modify. So like adding your logo for sure, but there's things that you need, like not changing the questions, not changing the own authorship on the bottom. You know, there's certain things that we can't change. And so in the next few weeks, Meredith and I will send that out to you.
And then Roseanne.
Go ahead, Meredith.
Roseanne had just asked about the Survey Monkey because we had talked a bit in the last month about the option to provide an electronic survey. That's something that you all will have to create using your own Survey Monkey account, but we're certainly willing to help walk you through that process if you've not done that and need assistance to that end. So no, that's an option also. And the reason that we can't do that Survey Monkey is because we're not the ones that need the results. So by you creating it, those results will come right back to you. All right, so we always leave our related resources up. Just a reminder that there is a business plan guide for DSMES programs. The link is there. Also, for any of you that are interested or working on NDPT or diabetes prevention, Becky Diorio is an amazing resource for that. So her contact information is included. And through Telegen, we have continuing access to our national expert, Marianne Fedorowicz, through our contract with Medicare, which ends July of 2019. So you can always get a hold of me if you'd like to take advantage of that free offering. If you could quickly answer the evaluation before you disconnect. And other than that, you know where to find Inca and I through this contact information. Happy to help at any time if possible. So thank you all for your time. And we'll hope to hear from you in October.
Bye, everyone. Thank you.
Thank you. Bye.
Thank you. Bye.